So, for this topic, for today's topic, we will be talking about Voudouris' analogy of light bulb or the light bulb hypothesis. That is technically you all must have heard by now when we are explaining about functional appliances, particularly the uh, advancement of mandible, the principle behind of how it works, what is the physiological and physiological aspects that you would see. So this was explained by John C. Voudouris and Lauren M. Kuftinek. So Voudouris and Kuftinek are the authors who have explained on how there is a growth relativity between how a mandible is brought forward and how and what type of changes that we would be seeing in the condyle of the mandible and the glenoid fossa of the petrous part of the temporal bone. So this article that we'll be going through is titled as Improved Clinical Use of Twin Block Appliance and the Herbst Appliance as a Result of Radiating Viscoelastic Tissue Forces on the Condyle and Fossa in Treatment and in Long-Term Retention, a Growth Relativity Study. So as I said, by John C. Voudouris and Kuftinek. Both are uh, from Canada, New York. Voudouris is from New York. Kuftinek is from Ontario, Canada. So to understand what goes on, the basic principle of how myofunctional appliances work is based on its viscoelastic property, where there is some amount of stretch that is seen around the condyle musculature and the ligaments, the tendons. That leads to a certain concept of, if you know by now, it is uh, tension and the pressure tension theory, uh, where there is a strain or a tension, stress in the pull of a muscle or ligament or any fibers, there is increase in the inflammation markers, which ultimately initiate the response of osteoblasts and osteoclastic responses, which leads to ultimately bone remodeling. So the main concept is that because of some functional demand, there are certain changes that are affecting in the condyle. So if you can see, if this is a condyle and some amount of mandibular displacement has happened, in this case an anterior displacement. So there is a stretch in the retrodiscal tissue, the fibrous capsular forces that you would see, and the synovial fluid that is being perfused over this stretch of musculature. So if you can see, this is a cadaveric model of the whole condyle, the articular disc, the superior head of the lateral pterygoid muscles and the inferior head of the lateral pterygoid muscles. The way that it's attached, so if you know, in a diagrammatic view, if you say this part is the inferior head of the lateral pterygoid that is being attached underneath the superior head of the lateral pterygoid, both of them attaching in the anterior portion of the condyle. So when the this is also the cadaveric representation. So if the condyle is advanced, the mandible is advanced, you can see the amount of stretch of the retrodiscal tissue. This part being the lateral pterygoid muscles that are helping it pull, that is being constructed. whereas the lateral discal tissues are being which is attached to the glenar fossa and to the posterior segment of the articular eminence. There is a pull in the latrodiscal tissues, leading the condyle to move away from the articular eminence. So, if you were to imagine just by understanding what is pressure to tension theory, so there is some amount of stress here, of course, from being pulled, and some amount of stress here that is being pulled away from the fossa, away from the articular disc. So you can see the remodeling occurring at the condylar head and also at the glenoid fossa just because it is being stressed apart. So when the articular disc and the condyles are moved forward, there is movements in the pre-positioning of the musculatures, new bone formation because of some amount of transduction due to the stress or the pull that is occurring in these tissue. So if you can see the anterior attachments of the retrodiscal tissue is being formed in the glenoid fossa, the transduction of resulting in the new bone formation which initially was here, which has come down to up to this point. So this shows that is a remodeling of lunar fossa and the articular disc. So this is the analogy where the condyle is set to a new position, reprogramming of all the muscles should happen since there is a pull because the mandible is being brought forward by an appliance. Since the condyle is pulled away, it behaves, it takes in account of three major principles. Why? One being the displacement of the actual displacement of condyle because of the appliance. Second were the viscoelastic forces that are occurring due to the stretch of the pull of the muscles away from the glenoid fossa. And transduction being where the new bone formation is occurring on the glenoid fossa to accommodate the demand is being that it is being subjected to because of the displacement of the condyle. So the analogy becomes that if there is a normal if the stretch is normal, there will be a normal condylar growth. If there is a change in the there is a change in the positioning of the mandible, it can lead to some amount of condyle to the fossa modification, and how the glenoid fossa and the condyles are changing its or remodeling. So there is no actual growth that is being taking place in the mandible. Rather than that is just some amount of displacement, not growth, some amount of displacement that is occurring. So again, it's a combo of being secondary displacement due to the growth of due to the deposition of bone in the glenoid fossa, or by itself deposition, that being the primary deposition in the condyle that pushes the mandible away from the middle cranial fossa. So in conclusion, hypothesis is presented for a mechanism of the condylar fossa growth modification when certain appliances such as herbs or twin blocks, since they are focusing on these two because the time duration when this article was released was during the popularity of herbst appliances and twin block appliances. So majorly what we understand is displacement of mandible, not the growth. Viscoelastic tissues extension forces to the condyle through several different attachments, which we already spoke about, be it the retrodiscal forces, sorry, muscles, lateral pterygoid superior head, inferior head, the fibers that are being attached from the posterior superior part of condyle to the glenoid fossa, Such attachments are being stretched apart. So transductional forces that are radiating beneath the fibrocartilage of the renal fossa and the condyle.